Hi, my name is Christine, and I had preeclampsia twice, which is a heart disease risk factor for women. My heart journey began in 2019 when I was 42 years old, and I experienced sudden right-sided numbness and weakness. I knew something was wrong, in part because I was in a postpartum program at the Ottawa Heart Institute for women who have had preeclampsia. I went to the ER and was referred to a stroke clinic where I was diagnosed as having had a mini stroke, or TIA, after they found non-bacterial endocarditis, which was likely autoimmune related. I spent the next few months in and out of ER with chest pain, pressure, and shortness of breath. I needed to know what was going on and was eventually admitted to the Ottawa Heart Institute for testing and to come up with a game plan with my new cardiologist to manage my pain, which he believed was caused by microvascular artery spasms. I was given medication to control the angina and went through a cardiac rehab program, which helped tremendously in terms of understanding my limits and building my stamina. My heart diagnosis was very challenging for my family and I, especially with all the uncertainties. It was particularly tough for my two very young kids who had to see me go in and out of hospital. Prior to my heart event, I had no other major risk factors except for preeclampsia. I had a great experience with my doctors, but I do believe it's important to speak up if something is wrong. Trust your instincts and get checked out. And of course, know your risks. Many women who have had preeclampsia do not know they are at an increased risk of heart disease and stroke later in life.
Hello, everyone. My name is Al-Khalaf, a research scientist at the University of Ottawa Heart Institute. In support of the Wear Red Canada campaign, here with us is Dr. Kara Nerenberg, an associate professor at the University of Calgary and a general internal medicine physician in Alberta, Canada. Dr. Nerenberg is an expert in women's heart disease. Today, I have the pleasure of speaking with her about certain pregnancy conditions that impact women and how these women can be at greater risk for heart disease. Thank you so much for being with us today, Dr. Nerenberg.
Oh, thank you very much for the opportunity to speak with you today.
Absolutely. Christine mentioned in her story that she had preeclampsia during both her pregnancies. Can you tell us a little bit more about what that means?
Sure. I think preeclampsia is a condition that's often really poorly explained to patients. So it's really nice to have an opportunity to talk about it. Well, first, preeclampsia or the high blood pressure conditions in pregnancy, they're actually very common. Somewhere between 7 and 10% of all women who are pregnant will experience high blood pressure conditions. And it really represents a range of high blood pressure conditions from just high blood pressure or what we call gestational hypertension, or a woman who might have pre-pregnancy hypertension, all the way through to preeclampsia, which is high blood pressure and other end organ involvement. And by that, we mean kidneys or high protein in the urine, or potentially brain involvement or heart. Then we get all the way up to severe preeclampsia, and some women might have heard of this called toxemia or eclampsia or seizures or HELLP syndrome. And then unfortunately, the most severe, it can be associated with fetal death. So again, it represents a whole range of conditions. And Christine fell in the group that had preeclampsia.
All right. We would like to know, are there any long-term effects associated with having high blood pressure during pregnancy?
Mo, that's a great question. And certainly we know that the short-term impacts relate to mom and baby, longer hospitalized stay, baby ends up in the neonatal intensive care unit sometimes, and then very high blood pressure for several weeks or months after delivery. But we're now learning more and more that some of these changes actually don't go away or come back in the future and lead to premature heart diseases and stroke in many of these women. We also know that they start to accumulate early risk factors for heart disease, like becoming overweight or obese, high blood pressure, diabetes or prediabetes, and high cholesterol as early as within that first 4 years after delivery. So we get these signals from pregnancy that these women are on a health journey that may lead them to premature heart diseases.
Are there other pregnancy conditions women should be aware of that might carry long-term heart risks?
Yes, there are. So preeclampsia is often the one that's talked mostly about because it tends to have the highest risk of premature heart diseases. So again, by that we mean heart attacks, including in strokes, heart failure, arrhythmia, or irregular heart rhythm. But we're now also, so if women who've had the high blood pressure disorders, their risk is somewhere between 2 and 5 times higher. There's a long list of other conditions, but their risks are generally less than 2 times higher. So I'll go through some of those. Some of those include gestational diabetes, or what we call new onset diabetes during pregnancy, preterm birth as well. So a baby that's born before 37 weeks or even before 32 weeks is associated with close to a doubling of the risk of premature heart disease. There's also a longer list of pregnancy complications that we're now learning about as well that may increase a woman's risk of heart disease too.
Now, what sort of treatments are available for high blood pressure disorders of pregnancy?
I love that question because I think there's a huge opportunity for prevention when I get asked that question. So we do know that with preeclampsia that there's an issue that the placenta doesn't implant as well into the woman's uterus. And it's thought that aspirin, so baby aspirin, helps with that implantation. And studies have shown that aspirin in women who are at high risk of preeclampsia can actually reduce their risk of developing early preeclampsia by somewhere around, reduces it by about half. And so there really is an opportunity to prevent preeclampsia. Similarly, if we have a woman who's at risk and weight loss before pregnancy, weight maintenance during pregnancy, so gaining the recommended weight, and physical activity, actually just achieving the 150 minutes a week has actually been shown to reduce the risk of preeclampsia again by about 50%. So we have these preventative interventions that we can implement early in pregnancy or beforehand with healthy health behaviors to try to prevent preeclampsia. However, once high blood pressure does develop, it's really important that a person is followed closely by a team of doctors, maybe obstetricians, maybe high-risk obstetricians, depending on what's available in the community, to really lower the blood pressure during pregnancy. We now know that it's important and safe to lower blood pressure, and we have a range of medications that we can use to safely treat blood pressure during pregnancy. It really is important that these women are followed by high-risk teams to keep a close eye on the baby to make sure that baby is growing well and help plan the delivery. However, once preeclampsia has started, it's a little bit frustrating for people who are pregnant because we don't have a lot of other great treatments once preeclampsia has started, and ultimately it may lead to early delivery of the baby and the placenta to stop the condition from progressing.
Following on that, if someone has experienced one or more of these pregnancy conditions, what should they know?
Yeah, so they should know that, first of all, it's common and that there really wasn't much that they could have done to prevent it. And I think that's a really important message for people to hear, because they often start to question, what could I have done differently? And truly not much. However, it's really important that women are informed of these future risks. Again, we see an early accumulation of high blood pressure, prediabetes, obesity in the first 4 years after delivery. So we really want to get the message out to people who've had these pregnancy conditions that they need to follow up with their doctors, whether that be their primary care team, their nurse practitioner, a family physician, to have that conversation about their future risk, to try to individualize that risk based upon her other risk factors, and then start checking for things like high blood pressure, high cholesterol. Maybe that might be annual checks with the doctor or their healthcare team, or it could be every 3 years. But having that conversation early to know that they may be at risk of these conditions and to really start focusing on a really healthy preventative health journey throughout the remainder of their life, and also start talking about the next pregnancy and what could potentially be done to monitor and have a better outcome in the next pregnancy.
Thank you so much, Dr. Nerenberg, for taking the time explaining these certain pregnancy conditions and how these can lead to greater risk for heart disease.
Well, you're welcome. Thank you.
We want you to be mindful, curious, and proactive in the management of your heart health and wellness, because to take care of others, you need to first take care of yourself. Stay safe and heart healthy. And to learn more about the unique aspects of heart disease in women and what you can do, visit WearRedCanada.ca or speak with your healthcare provider. And join us on February 13th for Wear Red Canada.